What's up, y'all? I just wanted to check back in. It's been about, let's see, today is Sunday. I had surgery on Friday morning at 8:30 in the morning. So it's been about 3 days, 3.5 maybe. I'm up and walking, which is kind of good. I can get around, even in the first day, like Friday that afternoon. I was able to go to the rest area and pee by myself, well, with crutches. Standing up isn't so bad. It's really just like bending the knees and flexing the quad. It's kind of tough. Still is, but walking, I'm getting there, and I'm off of pain meds. I took oxycodone for the first maybe 2 days. Today's my first day without it, and my last night was without the hard drugs. I want to get off of those as fast as I could, and I'd say maybe 12 hours after I took my last one, I took my first shit, which was super dope. It was an incredible amount. If that's too much information, sorry. And then I took a second shit, which was like an equal crazy amount. So yeah, I think I'm back caught up. My digestive system is back intact. Just wanted to give you a pro plug. This thing right here, super nice. The two arms on the side are probably the most key, because honestly I just been dropping it like from up here. Like, I really haven't been resting my cheeks on it. But it's nice to be able to, like, I can't really bend my legs just yet, like not so much. So having some rails to like kind of sit up on. And then, yeah, obviously if you're not like all the way down in a squat position, your cheeks aren't very wide. So pro tip, get some butt wipes, like just clean that ass good. Because honestly, that's, you can't take a shower for like 4 days. Like, I have to wait. Make sure you wear some shorts that you can pull over your knees, over the whole brace. I'm at my grandparents' house right now. They went off to a party, so I'm just kind of here hanging out. They set me up. This is my little spot right here. This is the cooler. So at U of M, University of Michigan Hospital, they gave me these two things right here. They have ice in them. And they kind of filter out water. They circulate water through these tubes. And it connects right here. I have it on both of my knees. And it's a little strap that goes around this way. But it's good for keeping down inflammation, as well as some pain, obviously. They have me cooling down, like keeping it on me for like 10 to 14 hours a day, which is kind of crazy, but and I don't know what that does long term to like blood vessels and whatnot, but it's also not like extremely cold temperatures. It just it's not like regular icing, you know. It's just like a cold therapy maybe. What else? It's been about 3 days, and you can see like I'm kind of walking just straight-legged. And I'm on really no pain meds. I took my last Tylenol maybe 6 hours ago, 6-7 hours ago, which you're supposed to take 2 every 6 hours. So doing pretty good. Obviously. The mental side is, there's always going to be, you know, the doubt. Like, with this type of surgery, it's not like I tore my ACL and it's a for sure thing I need a surgery. This one is more of a decision that I had to come to. Like, is this the best thing for me? And it was kind of in the dark, you know. I don't really know anyone that has had this surgery. So yeah, this is for anyone that's thinking about doing this. And I'm still kind of in the dark, you know, like I'm still limping around, and I'm not back to full strength or anything like that. So, yeah, the mental side is still like up in the air, you know, like I'm looking for the best, obviously. Like it's going to be a combination of believing in that end goal of being 100%, as well as like keeping myself in check, like not, I don't know, I guess bending over to to the idea that it might not happen. So just staying hopeful, you know, doing everything in your power to keep on it. I'll stop moving around. I'm sure this is a lot for people. But yeah, if you're in the same position, keep with me. I'll be making more videos, but just wanted to update on 3 days after the surgery, kind of where I'm at, where the pain is. And yeah, honestly, I didn't think it'd be this good. I still haven't had my post-op appointment. I haven't really had a conversation with the doctor just yet. They relayed to me through my mom, but I have some additional questions. I'll see him a week after the surgery, so in about 4 days in Ann Arbor. Yeah, honestly, icing has helped a lot, I think. It's really kept the inflammation and the pain down. Getting off the oxycodone, because you won't be able to shit on that. Like, and as soon as I got off of that it was like, all right, the floods are coming. So it was, yeah, be careful with the oxycodone. Get off of it as soon as you can, because you want your body to get out of that like shock factor, like do everything possible to keep your resources, and I don't know, you definitely don't want that to happen for too long. Yeah, that's about it. If you have any more questions, I can try to answer it. But yeah, just trying to remember what's going on right now in those 3 days after surgery, and trying to keep you guys on my progress. Just kind of being a guinea pig for everybody that, you know, is thinking about this surgery or potentially going to get it. Yeah, trying to think of anything else. The massage gun has been super dope. I've been going into my quads a little bit and just getting out any tension, like trying to move some muscles around in there, and then just flexing my calves, doing some toe raises, like I can do those. Trying to stretch. I can do all this, popping out my hips, trying to counteract all the sitting and laying down that I've been doing. Even some balance work. Eventually getting down this way. So you can go back. Anything backwards you can do. It's really just like going forward that kind of hurts. So doing all the stabilizers. Your feet are good. Just bending wise, I can go a little bit. Pretty pain free, honestly. Yeah, ask any questions.